Hello, this is Elizabeth Holland at the Centers for Medicare and Medicaid Services. Today, we're going to walk through the MIPS Promoting Interoperability performance category. Next slide, please. So this is a disclaimer, and we're using this webinar to help you understand the program, but it is not a legal document. We do have regulations that support what I'm going to tell you today, and feel free to review those. They're on our website. Next slide, please. So this is our agenda for today, pretty much focusing on promoting interoperability. Next slide, please. Next slide. This presentation will review the participation requirements for the Promoting Interoperability performance category. It's focused on 2024, and you are in the data collection period right now. As a review, Promoting Interoperability now has a 180-day performance period. So it's no longer 90 days, so make sure you are collecting data so that you will have enough data to submit in January 2025. We also have a general MIPS overview, which is a brief overview of all the performance categories, and that is available at this website here listed on the slide. Next slide, please. So just as a reminder, as I was saying, we are in this performance year for 2024. It ends at the very end of the calendar year, and then we go into our data submission period. And that is when you're submitting your 2024 data. And this is for all the performance categories. You will submit for quality, improvement activities, and promoting interoperability. Cost, the fourth performance category, is calculated by CMS. I will add too that during the performance year, we do have the opportunity to apply for hardship exceptions. And so you need to apply if you think you'll need a hardship prior to the start of the data submission period. Once we get all the data, we look at the data, and then we turn it around for clinicians so they can look at how they did. 2 years after the performance year, so that for 2024, that would be 2026. That is when the payment adjustments for 2024 will be applied. So you understand that we will update all of your claims that are paid through the Medicare physician fee schedule. And depending on what final score you achieve, you could either get a neutral payment adjustment, a positive payment adjustment, or a negative payment adjustment. And that would be applied to all your claims with dates of service in 2026. Next slide, please. So MIPS eligibility, as I mentioned, you report data for the 3 performance categories listed here. And on the right, you see that CMS does the calculation for cost, so you don't have to do anything for cost. So you see the number of points you can achieve is 100. And that's made up of adding up the percentages here. So promoting interoperability is 25% of your score. Next slide, please. Okay, so there are several reporting options, and you need to choose one. So we have traditional MIPS, and that has been around since the beginning of the program. And you look at the inventory of quality measures and see what's applicable to you. Same with the improvement activities inventory. And you have choice over what you need to submit. And promoting interoperability, there's very little choice, but you have to submit all the requirements, and that's the measures and the attestations. And cost, as I said, CMS submits. MIPS Value Pathways, or MVPs, are a new option. And what CMS did was we created groups that would be more meaningful to certain types of clinicians. So, for example, we pre-select a group of quality measures and improvement activities to make it easier for you so you don't have to go through all the measures if a particular MVP fits your specialty and practice. For promoting interoperability, the same exact requirements exist under MVPs as in traditional MIPS. And the third option for participation is the advanced payment performance pathway. And so this is a little more complicated. This webinar is only going to focus on the traditional MIPS. So we do have other webinars on APMs, and I request that you look at those webinars and all of the educational materials we have on our website. Next slide, please. Okay, so now we're going to get into the guts of the promoting interoperability performance category. Next slide, please. So promoting interoperability has its roots in the Medicare Medicaid electronic health record incentive program. So the basis behind it is that you must use certified electronic health record technology, and you use this to exchange information, to give patients access to their information, and a whole bunch of data collection points. Next slide. So as I mentioned previously, promoting interoperability performance category is worth 25% of your MIPS final score, and it is actually worth 30% if you are participating in an APM entity. So the performance period is now 180 continuous days. You can certainly select a longer performance period, but it needs to be a minimum of 180 days. For the most part, the category uses performance-based scoring, and the requirements for the certified electronic health record technology are set by the Office of the National Coordinator for Health IT. And so we rely on them to certify the EHRs. And then when you submit your data for promoting interoperability to CMS, you have a CMS certification ID that indicates the collection or the complete EHR that you're using. Next slide, please. Okay, so we recently updated the CERT definition. It used to be focused on editions. So we had 2011 edition, 2014 edition, et cetera. But the editions, we couldn't quite keep up with all the updates that were being made to CERT. So instead of using the edition in the name, we are now just referring to it as the ONC Health IT certification criteria. And so when ONC does updates, it will automatically update our requirements so that everyone would be up to date on the certification requirements. Next slide, please. So we used to do a lot of reweighting, which means that the 25 points assigned to promoting interoperability get reassigned to another performance category. And essentially, we did this for many of the different clinician types that were not eligible for the EHR incentive program. So in the rulemaking, we discontinued the automatic reweighting for all of these different types. The only type of clinician that we are currently reweighting are the clinical social workers, but now there's no automatic reweighting available, but if you are having difficulties and you're one of these types, you should look at our hardship exception types to see if one of them fits your situation. Also, as I mentioned earlier, we used to have a performance period of 90 days, but now it is a minimum of 180 days. Next slide, please. Okay, the other change we made is that we modified the second exclusion for the query of prescription drug monitoring program, or PD&P measure. Before, it was like too narrow. It said you didn't prescribe any drugs, and lots of clinicians prescribe drugs, but they don't necessarily do Schedule 2 opioids or Schedule 3 or 4. So we changed this to specifically fit the measure. We also finalized that for the safety assurance factors for electronic health record resilience or SAFER guide. We used to accept a yes or a no for this measure, and starting in 2024, you must submit a yes. If you leave it blank, or if you submit a no, that doesn't follow the measure. Next slide, please. Okay, so we talked about you submit your data unless you're a certain type, and the only type now is the clinical social workers, as I mentioned. If you are one of these other types, like ambulatory surgical center-based or hospital-based or non-patient facing or small practice, and we define small practices as being 15 or less clinicians, or you have an approved hardship exception, so that means that you took the action to submit an application and it was approved. For all these types, you are automatically reweighting. However, if you decide that you want to submit your data because you think you'll do really well on promoting interoperability, you may do that. The act of submitting data will automatically cancel your hardship. Next slide. So you, if you're participating at the APM entity level, that means you submit your data for promoting interoperability at the APM entity level. So that means if your APMs have different cert, what you'd have to do is add up the numbers from each iteration of cert to be able to submit. Next slide, please. Okay, as I mentioned, we do have an opportunity for hardship exceptions. It used to be that you were limited to the number of hardship exceptions you could apply for over your lifetime. And for hospitals, that 5-year limitation still exists. But for clinicians now, there's no limit. So when you apply, you need to cite one of the following reasons. You have decertified EHR technology. That means that the ONC, the Office of the National Coordinator, has taken action and has pulled the certification of the certified product. If you have insufficient internet connectivity, if you have extreme and uncontrollable circumstances, so that could be a disaster, financial distress or vendor issues, or you lack control over the availability of cert. That would mean that you work in a practice where the leadership of your practice has chosen not to have cert, and so it's out of the scope of your control. So definitely, as I mentioned earlier, the hardship exception period is open, and you need to apply during 2024 because it closes when data submission opens in 2025. And again, small practices are automatically reweighted, so they don't need to file for a hardship exception application. Next slide, please. Okay, so now we're going to delve into reporting and scoring. Next slide. So we have a number of objectives, and under objectives, we have measures. So the 4 scored objectives that we have are e-prescribing, health information exchange, provider to patient exchange, and public health and clinical data exchange. Depending on your HIE options, that will determine if you're submitting 6 or 7 measures. There are definitely attestations that are also required. Many of the measures that are required have exclusions. So if you qualify for the exclusion, that would mean you don't report data for that measure and you claim the applicable exclusion. You have to collect data for all your measures for the same 180-day period. And so if you're counting for 180 days, the last day to actually begin is 180 days from the end of the year, which happens to be this year, July 5th. Next slide, please. Okay, so some of the other reporting requirements is you must conduct or review the security risk analysis on your cert. If you happen to change cert, you need to do another full review every time you change. And you submit your data for the same 180 days. Next slide, please. Okay, so in addition to your required measures, you have attestations. So we have an information blocking attestation, which are actions to limit or restrict the compatibility or interoperability of cert. So you must attest yes to that. If you attest no, you will fail. The ONC direct review attestation, which essentially means if they're reviewing a vendor and they contact you, you would agree to assist them in their investigation. So this measure, you can either attest yes or no, but you need to attest one of those choices. As I mentioned, the security risk analysis and for the SAFER guides, it's just one guide. It's the high priority practices guide. And again, you must attest yes and complete the measure. And for the public health measures, there are two required measures, and you must, when you submit your measures, you must also submit your level of active engagement. And there are two levels of that active engagement that you can choose from. Next slide, please. Okay, so these are the attestations that I just mentioned. To just give you a little more detail, all of this information we have on our website as well if you need to review. Next slide, please. Okay, so these are actually the scored measures. So for the first objective, which is e-prescribing, you have the prescribing measure, and you need to submit a numerator and denominator, and that's why the points will vary between 1 to 10. You must have at least a numerator of greater than 0, at least 1 in the numerator. For the query of PD and P measure, there are 2 exclusions, and the measure is yes, no. For health information exchange, it's a little more complicated because you have 3 choices. You have the choice of submitting the 2 support electronic referral loops. One is for sending and one is for receiving and reconciling. Or you could do the HIE bidirectional exchange, and that's a yes-no measure. And the third option is enabling exchange under TEFCA, which is 30 points. And we're very excited about this measure and recommend people look into it. It was just launched, TEFCA was just launched in November. And so we're hoping that there will be clinicians who are engaged in TEFCA in 2024. Next slide, please. So the provide patients electronic access to their health information. There's actually no exclusions for that, but it is a numerator and a denominator measure. So you need to have a numerator, again, a greater than 0. It must be at least 1. For the public health, there are 2 required measures, the immunization registry reporting and the electronic case reporting. And so if you attest yes to both, or if you attest yes to one and claim an exclusion for the other, you would get the 25 points. If you claim exclusions for both, those 25 points get moved to the provide patient electronic access to their health information. You also have an option to earn some bonus points. So if you report on any one of these public health registry reporting, clinical data registry reporting, or syndromic surveillance reporting, any one with a yes could earn you 5 bonus points. If you submit 2 of them, you're still only going to get 5 bonus points. Next slide, please. Okay, so as I mentioned before, there's 25% of the final MIPS score. So if you earn the bonus points, you still can't get a score of over 100. And so what we do is we total up all your points and then we multiply it by 0.25, and then that gives your points that are going to be calculated into the final score. Next slide, please. And so, as I mentioned, your performance rate and e-prescribing is a great example because it is a numerator and denominator measure. And so we turn the fraction into a percentage, and then we multiply by the weight of the measure to get the number of points. And on the bottom, we just explain our rounding rules so that if you're wondering. Next slide, please. Okay, so for public health, I think I already mentioned this, but just to review, if you submit an exclusion and a yes, you earn the full 25 points. If you submit 2 yeses, you earn the 25 points. If you claim exclusions, that 25 points gets redistributed. And if you can't submit this measure or any of the required measures, and you submit a no for both measures and no exclusions, you just get a 0 for the whole promoting interoperability performance category. Same as if you submit a 0 numerator for any of the numerator and denominator measures. Same if you neglect to do one of the required attestations. Any failure of a requirement results in a 0 for the whole performance category, which could have a big impact on your score since promoting interoperability is 25%. Next slide. Okay, as I mentioned, there are bonus points. And again, you can earn 5 bonus points, and it doesn't matter how many you submit. You only need to submit 1 to get your bonus points. Next slide, please. We're going to talk a little bit about reweighting next. Next slide, please. Okay, so we talked a little bit about automatic reweighting, and this means you don't have to do anything for promoting interoperability. We were automatically reweighting your 25% to another performance category. However, if you submit data, we cancel that reweighting, and your data that you submitted for promoting interoperability will be scored. Next slide, please. Okay, so you have several ways to submit your data. So you could sign in to our website and automatically manually enter your data. You could sign into our website and upload your data, or you could have a direct submission using an application programming interface through a third party. And that could be a qualified registry or QCDR. Next slide. So we're going to close with some help and support. Next slide, please. As I've mentioned many times, we have wonderful information on our website. So the first link here is to our website. We have a participation tool that lets you figure out if you're eligible for MIPS, because maybe you're not. Maybe you don't have enough Medicare volume. But definitely look at that participation tool and look every year, because it is possible that your status could change. You can explore all the measures and activities. So that's for improvement activities and for quality measures, as well as promoting interoperability. You can learn more about our MIPS Value Pathways, or MVPs. We have a whole resource library. We have a webinar library where this webinar will live. So if you need to refer back, you can do that. We do have a help desk that you can reach out to for more personalized support. And we do have a small practices newsletter. And I highly recommend that you sign up for our listserv, because then you get automatically updated on anything that's new happening with the program. Next slide, please. So to contact our service center, you can either email them and create a ticket where you put in your questions or your issues, or you could call them between these hours. Next slide, please. And that's it for today. I hope you enjoyed learning about the Promoting Interoperability performance category.